that work?
I'll just give you 2 minutes the introduction about both of you. Then after that, you will take the session.
Okay, great.
Until now, it is live. Okay, well, thank you. Very good morning at US and very good evening at India and Varanasi. Thank you to join with us and very good evening in Varanasi for the participants also. Today, very special session under the course Fundamental of Social Design from Department of Applied Art, Faculty of Visual Art, Banaras Hindu University in association with Department of Social Design, Maryland Institute College of Art, MICA, Baltimore, Maryland, USA, and Michigan State University also. It's a very happy moment to all of us. Right now with me are two scholars from the MICA is already joined with it, the Becky Slogris and Isa Patni. Both are the concerned faculty and associate from the MICA. Now, Becky Slogers is the Associate Director at the Center for Social Design at Maryland Institute College of Art, MICA, where she is responsible for program coordination, operations, and communications for various initiatives engaging MICA students and faculty in social innovation projects in Baltimore, nationally and internationally. I welcome Becky to this forum. Now I'm just giving the introduction about Isa. Isa Patni Creative Placemaking Initiative. She is Mass 20 student, is a social design associate with the Creative Placemaking Initiative that is being led by MICA Center for Creative Citizenship and Office of Strategic Initiative. Isa works to develop a means to engage key project stakeholders to uplift the embedded community knowledge in a process of re-informing, redesigning, and implementing the creative placemaking vision. She collaborates with key practitioners and experts in planning and facilitating discussions through the human-centered design process to pinpoint the core competence and other components of credentialing program to advocate for change and integration of creative strategies. Now I am welcoming both of you and handed over the session to both of you. Start as per your requirement. Welcome.
Thank you.
Awesome.
I also request
so much
you,
for
if
having
possible,
us.
the participants is now connected with the Cisco WebEx. If possible, please open the video also. It's better for the interactive session. Please.
Awesome. Thank you so much for having us. We're really excited to be here. It is morning in Baltimore, so good morning, Isha. And as you said to everyone tuning in from India, good afternoon. We're excited to be here with you today. So what we want to share with you is a project that we call Design for COVID and give you a little bit of a background on the Center for Social Design and human-centered design, but really focus on Design for COVID as a case study, because it is something that Isha and I are in the middle of right now. It is a case study, a project that we started in January and that we are continuing to work on, and it's very relevant, I think you will find. So my name is Becky Slogris. I'm the Associate Director at MICA's Center for Social Design, and I'm joined here with Isha. I'll pass it to Isha to do a quick intro.
Hi, so I'm Isha, and I am the Social Design Associate from Pune, India, currently based in Baltimore.
So a little bit more about MICA's Center for Social Design. We are based in Baltimore, Maryland, and we are dedicated to demonstrating and promoting the value of design in specifically how design can advance equity and social justice. And in addition to really focusing on the value of design, we have a master's program, a one-year master's program. And through that master's program, we really focus on inspiring and preparing the next generation of creative change makers. But before we get too far, I want to do some language setting and really define and explain what is social design to us. So we define social design as a creative practice that is dedicated to understanding social problems and then supporting positive social change. And the process that we use is human-centered design, and it is extremely collaborative, really creative. And this process that we use helps us understand people's needs and then design interventions to better serve those needs. So why human-centered design? Of all of the processes you could use, all of the approaches, why human-centered design? Because it involves people in every step of the design process. You'll see how we include people at the beginning, middle, and end. It's not an afterthought, it is integrated throughout. It opens up the potential for new ways of doing and making. Because people are involved in the design process, we come up with really exciting ideas that we never would have considered if we were sitting in our studio alone. And because of that process, it ultimately results in more meaningful and valuable outcomes. Because people have been a part of it from the beginning, they're more excited about implementing and actually bringing those ideas to life. So human-centered design is really powerful in that way. And I wanted to share with you one of my favorite memes, this graphic of the baby and the parents. And you can see how different people have different perspectives of things that have been designed. And I like to keep this in mind when I think of the importance of engaging the end users, because it is hard work, but ultimately it is so much more valuable to really design with and not for. So when you're thinking about design, I want you to think really liberally about what design can be. So it can be creating a product. So this image is a set of training manuals on hearing devices for older adults that we designed as part of a study called HEARS. It can be designing a space or an experience. This is a photo from a pop-up event that we created with the Baltimore City Health Department to support Baltimore residents in creating smoke-free homes. We called it Healthy Air. It could be a service. So this is an image of a mobile farmers market that we created with a local farm in Baltimore to help them bring the food from the farm to Baltimore neighborhoods. It could also be designing a system, something more abstract. So this is a plan that we created with an organization here in Baltimore to encourage Baltimore families to read. And the strategy was to disseminate messages about reading through trusted partners. So everything can be designed, and I want you to just keep that in mind as we move forward. So the process that we use, the human-centered design process, includes a series of divergent and convergent phases. And I'll break it down step by step for you. The first is frame and plan. And at this stage, we really converge and organize all of the existing scientific data and research associated with a problem. And at this point, it's really important to get specific with what the design challenge is that we're trying to address, because we know that you can't do it all. You can't boil the ocean. So the goal of this stage is to really appropriately scope the engagement based on the time we have, based on the team, based on our resources. And then from there, we diverge. And at this point, we become sponges. We try to collect as much information as possible about the problem. And we do that by actually talking to people, again, engaging humans, engaging our end users. And we do observations, we might do interviews, we might go out into the community and attend different events. And it's really about learning from stakeholders, everyone from someone with lived experience as expertise to someone who might be a subject matter expert, and trying to better understand what people need as well as what assets they can bring to support the project. So once we've done that research stage and we've collected everything, we focus in again with synthesis. And we compile all of our observations, our research findings, and we start to look for common themes and insights. So what is the research telling us? What stands out? And it's really important at this point that we don't come in with predetermined plans. Our goal is that we let the research tell us what is needed. We embrace unexpected insights, ideas, and inspiration in order to find areas where we can ultimately intervene. So we end this stage with different possibilities, different opportunities that we want to then ideate around. And at ideation, we converge again and generate as many, or diverge, we diverge again and generate as many ideas as possible with our partners, with our stakeholders, and try to defer judgment. More ideas are better at this point, because in the next phase, we take those ideas and we begin to prototype and test them. And we bring those ideas to life by creating tangible 3D representations of those ideas that people can interact with and provide feedback on. So a prototype could be creating wireframes for an app. It could be building a new product out of cardboard or even pipe cleaners and Play-Doh. The goal is just to create inexpensive, cheap prototypes so that we can test any assumptions that we have and uncover any issues as early as possible without spending a ton of money. And from prototyping, we get to a point where we can then take what we've learned and implement something. And it might be that we're implementing just one product or one idea, or it could be a series of ideas working in tandem. But the process isn't over at that point. We implement them and we continue to iterate. We continue to collect feedback and really put the project out into the world. We're always learning and evolving what is created. A solution is rarely ever done. That is a key note to make. So that was a lot, I know, kind of a crash course in human-centered design. And we wanted to walk you through how that process gets applied to a real-world case study. So this is the Baltimore versus COVID project that we'll be sharing with you, and we'll break it down step by step. So we had a really awesome opportunity early this year to join some really amazing partners in Baltimore, our local Baltimore City Health Department, the International Vaccine Access Center from Johns Hopkins and Morgan State University. And each partner is bringing a really unique experience and set of expertise to the table. And we have all come together because we have vaccines now, and we want to make sure that Baltimoreans have access to them and that they have information so that they can make their own decisions about if they want to get vaccinated or not. So when we began the project, we started with framing and planning, and we wanted to really look at the context of what the city was doing and take in the overall strategy. And at this point in January, the Baltimore City Health Department was beginning to create a strategy around how we could get vaccinations out to people. And their goal continues to be achieving population immunity against COVID-19 through vaccines and really having support from residents, community organizations, and businesses across the city. So there are so many partners at the table. We are really just one piece of this much, much larger puzzle around vaccination in Baltimore. And I want to pause for just a moment to unpack what population immunity means. This is something that you have probably heard a lot about in the news. Population immunity or herd immunity is what happens when a virus can't spread because it keeps encountering people who are protected against the infection. And the thing that is fascinating to me about population immunity is that not everyone needs to get vaccinated. You just need enough people to be vaccinated. So Baltimore City is aiming for population immunity. Their goal is to reach 80% by next February 2022. And they understand that in order to achieve that population immunity, we have to reach the people who are the hardest to reach, the people who are disconnected from healthcare, the people that are most vulnerable to COVID-19. And we are calling these our special populations. So this includes underserved older adults, individuals experiencing homelessness, the Latinx community, the Orthodox Jewish community, pregnant and lactating individuals, young men between 16 and 24 years old, immigrants and refugees, as well as people with disabilities. And each one of these groups has a unique set of needs and assets to bring to the table. So we really are focused on these audiences and making sure that we're serving them in the specific things that we need or that they need. So our overall design challenge is how might we encourage Baltimore residents to get vaccinated with a focus on those communities, those special populations. And I'm going to pass it on over to Isha to get into the fun part, the research that we did on this project.
Thank you so much, Becky. As Becky explained, after we had our design challenge together, the next step was to really dig deep into research and understanding the context and the people that we were going to work with, essentially given these value communities. So the first step that we decided to do was to do some secondary research and read articles and different papers that were written on human-centered design, design justice, equity-centered design, because we wanted to ensure that our work was centering equitable healthcare measures in healthcare in US. It was really important to be able to understand the background and the history before we proceeded with anything else. Along with some of these readings over the world on the COVID-19 Communication Inspiration Challenge, which was conducted by OpenIDO. Along with that, we also watched a recording of a community forum with Dr. Corbett, which was enlightening as she was also from Maryland. She's also from Baltimore. She studied in Baltimore. So we had like a personal connect with her. And it was really nice to see how she was involved in the whole process of conducting the trials. And she explained really how the vaccines worked very well. And I think that was necessary to start off the project. We also looked at language tips and tricks to better understand usage and syntax, to understand how campaigns work. Campaign languages work slightly different. So it was really important to understand that. And in order to understand that better, we also looked at a few case studies. So this was part of our analogous research. We looked at different campaign strategies from all around the world. Just a few examples here are, for example, there's emphasis on nation and vaccination in the Australian campaign. The Sleeves Up NOLA is a Mardi Gras based campaign from New Orleans in US. My Mask Protects You and Your Mask Protects Me. It was a very successful campaign in Alaska. And um, Washington's explanation for why it was taking so long for people to get the vaccine was really effective and worked very well in helping sort of bring order to the chaos. Um, and along with all of this secondary research, we conducted primary research, which essentially meant talking to the people that we wanted to learn more about. So this was conducted through listening sessions, which were essentially focus groups where we worked with our partners in getting sort of members of each community together for a listening session. These were all virtual sessions where there was a set agenda. So we would vaccines worked, why it was important to get the vaccines. If people had any concerns and questions, they could ask the doctor directly. And then we asked questions to our partners. What were their concerns about the vaccines? Why they wanted to get the vaccine? Who do they trust in their community? Um, and it was really exciting to see different people all together in the same room. So if you see in the left image, it's a screenshot from the faith community listening session. So there are rabbis, pastors, and bishops in the same room together. The one on the right side is a session with the Latinx community, which was conducted entirely in Spanish. With these listening sessions, what the thing that we were doing for each of them was creating visual notes to highlight and summarize key quotes, themes, and ideas. So the whole point was to be able to communicate back with the communities as to what had we heard, what had come out of this listening session, to also get feedback from them, to ensure that we weren't missing out something that was really important to them, that was said, that was important. So we conducted these visual notes. One of the examples that I can give is this visual note from the marginally housed group. It was a really wonderful listening session where they were being honest and vulnerable with us, and they spoke about how people are scared to receive the vaccine because they're concerned about mitigating side effects. So this was a very interesting point of view, that came up, an interesting observation that we, an important point that we received. And as you can see, lots of different things that came up in the session spoke about lack of information, lack of transportation, how there were lots of conspiracy theories and rumors about the vaccine. And this listening session was really important for us to be able to understand, what were the problems that we had to focus in on, what were the key insights and highlights that we had to really keep in mind as we went ahead with our designing and with our ideation session. These visual notes were very well received and were really important to engage sort of the top level leaders into what was being said. So it was a very good tool to sort of keep people informed, if that makes sense. So the next step, as Becky already mentioned, is synthesis. So this is where we converge, we come together to really think about what was being said. After we've done so much research, we come together to look at insights and look at opportunity questions. So the first tool that we used was to have an empathy map. So an empathy map, what we do is we sort of map out what the specific user is saying, thinking, doing, and feeling. And what this does essentially is to get a clear map or a clear view of this user that you're trying to design with. So it's really important to map all of this out so you know you're not missing anything important that was being said. So, for example, one of the key things that we heard from our older adults was that they were feeling left out. And that was really crucial for us to sort of keep in mind as we went ahead with designing things for them. So that feeling of being left out sort of got translated into us saying something like, "You are a priority," or "How am I going to get my appointment?" Like, older adults were really concerned about how were they going to sort of travel and get there to the appointment, to the vaccination appointment. And the response to that was that Baltimore City Health Department decided to have mobile response teams. So it was really important to have these emotions sort of mapped out to be able to understand better. Another tool that we used was an ecosystem map. So different communities have different points of interaction in the society, right? And they also have unique fears and relationships with institutions around them. So it was really important to map that out to understand what were these spaces and points in the systems that we could leverage. So for example, as you can see, the map on the left is the map with pregnant and lactating community. So really thinking about how sort of they have unique relationships with their healthcare providers. But also this map really helped us discover that they also have unique relationships with their doulas and other moms. So that sort of was a key takeaway for us and really helped and strategize our designs for them. Another example is that the one on the right side, the Latinx community has a unique relationship with the government and insurance organizations because of their language barriers. So really thinking about how can we leverage local language centers or local health centers that focus on, Spanish speaking community was key. Um, so some of the key takeaways from all of our research and all of our synthesis was people have a lot of unanswered questions about the vaccine. So there are also countless barriers to getting the vaccine. For example, transportation, language for people who do not speak English. Um, and there is also a lot of mistrust in the government and health systems due to the past and sort of historically oppressive policies that were based in this city. So with that, we decided to sort of create design principles. So design principles are essentially a set of guideposts that guide our designs as we go forward with it. So some of the design principles that we created were specifically for this project. For example, centering access, using existing systems of trust, taking note and taking action to bring ideas to life, finding sustainable solutions, being clear and transparent in our messaging, honoring people's COVID experiences. Just this is just to understand that people have unique and really different experiences from each other, and validating intersectionality within and among communities. So understanding that not so under each community there is difference and there is unique personalities, and no community is the same. And it's really important to keep all of these design principles in mind, as we were going ahead with our ideation sessions. So the next step, as Becky mentioned, is ideation. So this is where you really diverge. You go broad, you want quantity over quality, you want lots of ideas. So to start off our ideation session, we had 3 brainstorming prompts. These prompts are usually in the form of a how might we question. And why the reason that we do this is so that we center sort of the people who are a part of this, and who the people who are going to be experiencing these questions. So it's really important to sort of have a passive sort of tone to the question. So we use a how might we as a starting point. And these brainstorming prompts were taken directly from the key takeaways that we saw during our synthesis sessions. So some of the prompts that we see here. So how might we best share information so people feel more informed and comfortable? How might we remove barriers so that everyone can access the vaccine? And how might we promote trust through communications? So we asked these questions during our ideation or brainstorming session, as you can see here. And we really encourage our community members to think broad, to go wide, to think of as many ideas as they can, and to really not limit themselves to a certain kind of an output. um, and one of the other things that we did during our listening sessions was to also conduct surveys. So we use the Zoom poll feature, which is just so simple, to really ask them basic questions and just get an idea of where the community as a whole was at, to be able to sort of decide the strategy moving forward. We just to sort of have the brainstorming session, we use the chat feature in Zoom. We ask them these brainstorming prompts, as you saw earlier, and we just ask them to put in as many ideas as they could. in the chat or unmute and talk. And it was a really interactive sort of piece of the listening session. People were really excited and they had so many wonderful ideas. And then the way that we captured all of these ideas on the back end, as you can see, it was a lot of work. We had the spreadsheet document where we record all the ideas that come in from different community members. We usually sort of code them, try to understand, the priority of a certain idea, and we use another tool called Mural. It's really easy for it to be sort of an interactive technological platform where you can use it's sort of we sort of use post-it notes, so it's really easy to sort of keep all of the information together and move things around, look at what ideas were prioritized, what ideas were repetitive, what if there are any patterns, ideas that have come out. And then based on these patterns, we sort of created an ideation criteria. So what that means is for us to really think about what ideas are we selecting, what ideas are we pushing forward, and that is based on these three top level criteria. So thinking about the impact, right? Does this idea help us achieve our overall goals? Does it align with our timeline and strategy? Feasibility. We have the capacity and funding to implement it. Desirability, to ensure that that it responds to community needs and wants, and that it's not just something that we think we like, but it's something that the community really wants and is asking for. We also really want to keep our overall project goals in mind, just to remind ourselves that these ideas need to be grounded in this criteria. So from this criteria, we selected a few ideas to prototype. And prototyping is really, really crucial to get into for testing and validation. What you really want is feedback, right? We want to ask the community, does this idea work? Can we implement it in a certain way? So as you can see, these are a few examples of a few ideas that came out from our listening sessions. So one of the ideas that came out was a newsletter. And as you can see, we really sort of broke down the idea. So looking at what is the idea, how is it being inspired? What is the theory of change? How does it look? What is the texture? What is the feel? What content would go into a newsletter? What is the purpose? What is the purpose the newsletter serving? Looking at another idea, so some people said that they really don't know how to get to the vaccine, right? What is the process of the vaccine? So thinking about if we were to create a journey map. So what would that journey map look like? So really looking at what is that information flow that needs to be a part of this journey map. People said that they really wanted to know more about pre-COVID, pre-vaccine and post-vaccine information, which was not really around at that time anywhere. So really thinking about how can this information be given out. So as you can see, these are really rough sketches that are done just to get feedback. So we sent all of this out to our committee members, to our team members, and received lots of really important tips and ideas about how we can improve them. And then the next step is implementation and iteration, and I'm going to pass it back to Becky.
Thanks, Isha. So implementation and iteration, I want to start first with the overall strategy that the city of Baltimore is using, because we wanted to make sure that everything that we implemented was aligned with that strategy and things felt cohesive. As I mentioned earlier, we are just one piece of this really, really large puzzle, and there's a lot of moving parts. Things change daily. So we needed to be aligned in anything that we created to the overall strategy. And the city has a campaign that they have created called Baltimore versus COVID. So early on, we decided that we would all use that tagline. No matter what messaging or materials were going out to community members, it would all be branded as Baltimore versus COVID. So it felt cohesive to community members. And Baltimore versus COVID as an overall campaign has 3 pieces. The first is a mass media campaign that the city is creating. So billboards, bus shelter ads, radio ads, TV commercials, and that is targeting all Baltimore residents. And then where we fall in is this initiative called Value Baltimore. So everything that we have been doing with the special populations and co-creating with them and hosting listening sessions is part of what the city calls Value. And Value stands for vaccine acceptance and access lives in unity, education, and engagement. And the cool thing about Value is that the city has hired ambassadors from each of those communities. So we have a set of ambassadors from the pregnant and lactating women community, a set of ambassadors from the older adults community, a set of ambassadors from the Latinx community, and they then take the message and the materials to their specific community. So it's very much person to person, having conversations and going where people are. And everything that we create is something that we're creating with the Value ambassadors and something that they're actually then able to take into the field. The last piece of the Baltimore versus COVID campaign is provider education. So we wanted to make sure that when people go to their doctor or go to the hospital, that the providers are educated and know how to answer questions about the vaccine. So these 3 pieces, the mass media campaign, our work with Value Baltimore, and then the provider education piece, we're in constant communication and always trying to figure out how we can coordinate what we're doing. But zooming in specifically to Value and the strategy that Isha and our team that we have created together, what we realized early on is that each community has really specific questions about the vaccine. So each community is getting their own FAQ sheet and journey map brochure. So frequently asked questions and a diagram of how they can get the vaccine. And that is customized to each community. In addition to the brochure, we're also taking those ideas from the listening session and bringing them to life. So the idea that Isha shared around the newsletter is an example of something that came from that co-creation session from the listening sessions that we're building. And one thing that we wanted to share with you is through all of this, we're working really hard to make sure that all of our materials are accessible, because the disability community and immigrant and refugee community in Baltimore are communities that are often left out. They're often an afterthought in government initiatives. We wanted to make sure that from the beginning, we are translating all of our materials into different languages. We're collaborating with the National Federation of the Blind to ensure that all of our materials are easily accessible through screen readers. And we're in constant conversation with the disability community, their lead, to ensure that everything that we do after listening sessions is accessible. So the visual notes that Isha shared with you earlier are not accessible. So we, for the listening session with the disability community, are actually creating a text-only version of those visual notes. And then we're also working to make materials in Braille, in large print, plain language, and text only so that they are accessible. So some specific examples of what we are creating. Here's what the brochure looks like in action. And you can see that the sketch of the journey map has come to life and is the main feature of the brochure. So it walks you through how to prepare to get your vaccine, getting your vaccine, and then what happens after your vaccine. And this example is for pregnant and breastfeeding women. So the information within it is specific to them and questions that they have. Another thing that we're creating are just handouts and flyers that can be posted on bulletin boards or quickly given out at events. And you can see that we're taking the Baltimore versus COVID tagline and swapping out. So it's Baltimore versus COVID. It's also older adults versus COVID. It's pregnant and lactating women against COVID. And the idea is that we'll win this together. So taking the things that we heard from our individual communities and customizing the materials. One thing that the older adult community wanted to make sure that we understood is that they still like to have fun. And a motivation for them was getting back to the casino, getting back to family cookouts, spending time with grandchildren. So that has become a key message in our materials for the older adult community. And the newsletter that you saw a prototype of earlier, Life as well, publishing a newsletter that we're calling United in Community to keep all of the different stakeholders informed and have them learn from one another, since there's so many people involved in this initiative. It also gives us a chance to spotlight the ambassadors that are doing the work on the ground. So this is spotlighting the first issue of the newsletter spotlighted ambassador from the pregnant and lactating community. And she talked about why getting a vaccine was important to her as a mom and as someone who is breastfeeding. And telling those stories is something that we heard in every listening session. People want to hear from people that look like them and hear their stories and their experiences. So we are taking testimonials from different people, from our peer ambassadors and from folks who are getting vaccinated, and sharing their stories in a social media campaign. We also, as Isha mentioned, there are pop-up clinics happening around the city. So we have designed different signage and materials for those clinics so that when you go to the clinic, you know exactly what's happening. And also so that you can have a little bit of fun. We've created a photo wall that each clinic has where someone can fill out this form. I got vaccinated because I value my blank, and then hold the sheet of paper up in front of It's Baltimore versus COVID banner and take a photo to celebrate the fact that they got vaccinated. I'll pass it back to Isha to share the additional prototypes that have brought to life.
Yes. We also created this sort of a one-pager that talks about Meet the Ambassadors, right? So as Becky mentioned, the city has actually hired some of the ambassadors from this community to go ahead and really connect with people. So making this flyer was a point of view where we really wanted the community to understand, what were these ambassadors, who are these people that they can reach out to, talk to, and really have somebody as a friend in their community. And then along with that, we also made some business cards. So this was something that was for the ambassadors. So business cards that ambassadors can sort of hand out, really ask people if they have any questions, like reach out to them, be a really strong point of communication in the community. Along with that, we also created some Instagram stickers, like Becky said, like really keeping it fun and inviting more people. Also, as a point of view to involve more youth and people who are social media savvy to use their platform to really express and promote getting vaccinated for the city. Along with that, as you can see, we also have Facebook photo frames that we're still very much in the middle of this project, and we still have, as we speak, we still have sort of 5 to 10 other materials that are in the works, just lots of meetings every week. And it's just hard work and lots of teams and lots of people who are a part of this. So I really just want to give a shout out to all of them. And to just talk about the next step, so we are here, the next steps would be to keep implementing these ideas, to continue sort of to collect feedback from ambassadors and revise the materials, because as we know, as times keep going faster, like we have so much new information, and we just want to make sure that our materials are up to date and have new information as it comes out. And we, from MICA, the team of MICA, plans to keep providing additional design support for Baltimore City Health Department, in whatever other ways in this project. And then I will pass it back to Becky.
So that case study, as Isha mentioned, is still very much in progress. But there are so many resources out there that have additional case studies, additional tools about human-centered design. If you want to learn more, we highly recommend the Field Guide to Human-Centered Design from IDEO.org, their design kit. If you Google it, they have a website where they have all of their methods and case studies. And the Field Guide has been translated into many, many different languages. The middle guide that we also highly recommend is the Equity-Centered Community Design Field Guide from Creative Reaction Lab. We have referenced that throughout the project many, many times to make sure that the methods that we're using and the approach that we're using for the project is equity-centered. And then the last thing that we recommend is Health Design Thinking, Creating Products and Services for Better Health. This is a new book that is talking specifically about how you can use human-centered design in the healthcare space. And it is, again, full of methods, full of case studies, and is a really, really great read and resource. So I think we have made it to our questions. And I see that there are already questions in the chat. So I'll start.
The chat box, there is 3 to 4 questions are there.
Awesome.
You may select that for your accessibility.
This is great. So the first question I see is, how do you view the future of social design research, which involves a lot of field studies and face-to-face interaction with individuals, as we expect more frequent pandemics in the coming years? That is a great question. Isha, do you want to go first?
Yeah, sure. I definitely agree that social design research is very hands-on, is very non-virtual in its being. But I think that in the last few sort of months, people have started to understand and get a little bit more comfortable with virtual platforms. There are apps and things that are being created for it to be a little bit more easier. That being said, nothing beats a face-to-face interview or an observation, sort of a field trip, or really being in the space to understand, how things are going. So, I guess I don't really have a specific answer for that, except that, I'm being a little bit hopeful that we would have not too many frequent pandemics, and then just have more virtual sort of ways that can be developed to be able to do this research. And then that being said, I think people are also really understanding and getting used to the idea of being socially distanced, keeping 6 feet distance. So if, just even going out and doing research in person would also have to be sort of conforming to a lot of different pandemic, sort of rules and etiquettes, I guess. I don't know. What do you think, Becky?
Yeah, I agree. I think the pandemic has taught us that we are more creative than we give ourselves credit for, that we can adapt the methods and do things on Zoom, using Mural or Miro as brainstorming platforms, and you just find a way to make it work. But as Isha said, it's not ideal always. It's always best to just be able to be face-to-face with someone and really be in context with them. But we've gotten really creative over the past year with using Zoom for brainstorming sessions, for interviews. The listening sessions are a great example of that as well. Okay, so the next question, was there any resistance from people, from groups of various communities regarding vaccinations? If yes, how did they overcome it? It is important to know, as in India, there are some villages where there's a lot of resistance for vaccinations.
Yes.
Our biggest challenge, I think, right now is resistance among young men. And at our listening session with young men, they shared with us so many conspiracy theories, and we're super against putting anything in their bodies, especially anything created by the government, was what they were saying. So we actually had to pause the design process with that group, and we did another session with them where we could get them back together and have them talk to doctors who looked like them, who they could relate to, and ask some of those questions to really make sure that those conspiracies were debunked. And then moving forward, what we're trying to do with them is really listen to what they have said that they think will work. And knowing that young men probably aren't going to get super excited about a brochure, we did hear that they really wanted swag. They wanted freebies, like free t-shirts that they could hand out at events. So we're bringing in a local Baltimore clothing company, actually run by a Micah grad, Akia Jones, and his clothing line, the Be More brand. And he'll come together with the young men to design something that really feels relatable and something that they created themselves. So we'll see how that goes, but that's our strategy right now is really to continue answering the questions that people have and continue to co-create with them. And I think the other lesson that we've learned is that it's normal to be hesitant. It's normal to be skeptical, and just having patience with the people that we interact with and talk to. All we can do is make sure that we're providing them with the most accurate, up-to-date medical information so that they can then make an informed decision themselves. Isha, do you want to add to that?
No, I think that was perfect. That's exactly what I was going to say. I remember being in the listening session when the men were really sort of hesitant and talking about how there were lots of problems with being vaccinated, and they really did not want vaccines at all. But I know that we took some time, and really slowing down helped. Getting a panel together of doctors and professionals who really understood their backgrounds, were from their geographical locations, looked like them, really sort of helped them gain that trust. So I think it's just a slow process of gaining trust, but I think it's also very intentional. And I think that there is always scope to sort of build that relationship and build that trust. It's just going to take a little longer. But yeah, we are still, we're still not there, but we're on the path, and we're hopeful. Yeah.
And I think too, the overall strategy of the value initiative within the overall Baltimore versus COVID campaign is really brilliant, because it is hiring people from the community to go and talk to the community. And that strategy, I think, is what's going to help break down some of that resistance. Is just the more people can have conversations, get their questions answered, and have them answered by someone who is relatable and approachable, and not someone who is preaching from the health department or preaching from the government perspective. Should we go ahead and do one or two more questions? I think we have time.
Yeah, there is 2-3 more questions are there. If you cover it, that will be good for us.
Yeah. Awesome. Okay, so the next question, since this is the case study of COVID vaccination awareness, and India is one of the lead countries affected by COVID, sadly, How can the fear be cured of the people who belong to the very remote areas in India? That specifically, like, what are the easiest ways to reach them with awareness? That is a great question.
I think I would even say, just really thinking about a project that was conducted by one of my friends back home. I mean, I think one of the strategies that had worked was to really sort of understand the cultural context of sort of, why, or just sort of the remote areas in India, right, that they belong to, just their living, their lifestyle, or, just the way that they go about their day, their fears and their concerns, I think would be really helpful to understand, what is the approach that you might want to take with them. So if we know what are their fears, what are their concerns, what are the assets, what are their strengths, what do they bring to the table, what are they really good at, what is their community sort of strength, or what is their community weakness. I think that information would be really helpful to understand how you would want to approach them. So if there's certain sort of language that you want to use regarding sort of the awareness, or maybe you don't want to approach sort of it through just a pure scientific medical language. Maybe you want to approach it more from a storytelling, from a more narrative perspective. I think that there are different ways that the information can be disseminated, but I think it's more important to have that research in place to look at, to sort of understand where is the user, where are the people coming from, where is their hesitancy coming from, or to really sort of how can you break down what a vaccine is and why that needs to be taken, maybe in their own mother tongue. So maybe really understanding the language, the mother tongue can maybe help. These are just a few ideas from me.
Yeah, so the next question is about everything being online and how to do things like shadowing users or doing observations about problems. Since, and this is such a great point, since when you're talking with someone online, users are just sharing their experiences according to memory. And that's a great point. We actually did not do any observations or shadowing for this project. We really relied on the listening sessions as our primary method of hearing what people are seeing as barriers. So yes, they are kind of recounting things from memory, but that was the best that we could do given the situation with COVID. In Baltimore, I do think now that more folks are vaccinated, now Isha and I are both vaccinated, one thing that we can potentially do that would be exciting is to go and shadow the ambassadors and listen to some of the conversations that they're having with people now. I think it's safe enough now for us to do that, and that would be a valuable use of shadowing. But unfortunately, I don't have any tips or tricks for shadowing.
I have another idea. I know that a few different sort of health-based departments and institutions, even Johns Hopkins for that matter, they've really been using photo journaling and photo voicing as a tool. So just really telling sort of your interviewees or your, the people that you want to observe or, understand more about their lives, to really send in sort of like a diary entry or a journal entry in that sense, where with images, so just to like take pictures of my daily life, and you can maybe even have pointers, so like, at 10 a.m. what is happening in your house, just really simple. Ask them specifically to keep it candid. There's always going to be a chance that it's not going to be candid, but you just have to trust that, I guess, and hope for the best. But I do know that a few sort of researchers in Johns Hopkins have been sort of using photojournaling a lot, and they have been getting some really good sort of input and insights from that. So maybe that's a tool that could be used.
Yeah. So next question. As in India, the vaccine drive is going on, we are seeing a large population of villages which are not getting vaccinated due to fear. Many rumors are prevailing in those villages. So if we want to go down and make every one of them aware about how vaccines are safe, and one way to get out of the pandemic, will the whole process, which you just discussed, be the same or be changed? And how can we do it at a local level? That was a great question. I would encourage you all to take this process and customize it. I think there are lots of things that you can take from what we've done. But as Isha mentioned, like each community will probably have their own unique assets, their own unique needs, and you'll have to really listen to them to figure out what's needed. Do you want to add anything, Isha?
No, I think that was exactly what I was thinking. Yeah, because I know that sort of in India, there are very different concerns, there are very different backgrounds and histories. And a lot of sort of what we did was based on Baltimore's history and Baltimore's sort of local sort of cultural context. So I think that you would definitely have to customize it for how it would work on a local level. And that being said, I don't think that there would be a specific process that would work for a specific area. So, for example, I know that utilizing a process in Pune in India will be very different from using a similar process in Delhi, or it would be very different from utilizing this process in Nagpur or Nashik, which are completely different contexts. So I definitely think that you would have to really go local and really understand sort of the specificity of the place and the geographic location and the people that is being served. I see another question. So how can we encounter the dilemma of different companies' vaccines? Is most people waiting for Sputnik or one sort of vaccine because of its rate of efficiency? How do we dilute this to school? This is, I think, a great question. I know that Becky, we were working on that as well, right? To really look at how over here, do we sort of not sort of make people, go for a specific vaccine because, all of them are efficient, and they all work for different needs. But I guess, what did we really do? I mean, I'm trying to think about.
Yeah, I think in our language, our messaging, we've steered away from like mentioning efficiency rates at all. The messages that we use is that all of the vaccines are safe and all of the vaccines save lives. Like that is the key message. Some folks are interested, certain communities are interested in like the technology behind the different vaccines, or folks who have children want to know which vaccine their kids can get since there's different age levels. But we don't include efficiency in any of our materials, and really just try to stress that like the best vaccine is the one you can get. But that people can make their own choice and can go to a certain clinic if there's a specific vaccine that they want.
I think also just I think over here, given with the J&J vaccine, which was a one-shot versus the other vaccines, which were a two-shot vaccine, that was the only point of sort of contention when there were specific communities for whom it is just really difficult to get the two-shot vaccine, for whom we really sort of promoted and discussed how it would be good for them to get the J&J, just simply because of sort of wanting to reduce their travel or their commute so that they wouldn't have to travel twice or even looking at people experiencing homelessness, it's really difficult to keep a tab of when they got their first shot and when they would be getting the second shot. So at those times, those were basically the only times that we would be like, okay, I think that having the one shot vaccine makes more sense here, just simply because of the convenience of it. But yeah, I think other than that, in terms of efficiency, we really have not, um, yeah, been discussing that to keep it more neutral.
Yeah. So I think that's all the questions. We
Yeah.
want to
Thank
we
you.
want to say, yeah, thank you for having us. I'm leaving on the screen our
Sure.
website, micasocialdesign.com. Check it out. Check our case studies. I also encourage you to sign up for our newsletters or follow us on social media. We're always sharing new projects, and that's another way that you can stay up to date on this project in particular and what ends up happening. And then feel free to email me or Isha if you have any questions. We're always happy to chat.
Yeah, thank you so much for having us. This was really
Thank
nice.
you. Thank you, Isa, and thank you, Becky, for this wonderful session. And it's a very knowledgeable session for us also as a social designer, or as as an educator, because this type of campaigns is very much required in India also. Right now, government is contributing lots of effort in this field also, state governments and governments also. But as an
Yeah.
academicians and as in students, we also put some efforts here. I'm requesting to my Indian participants, if possible, please ready with any campaign or planning. Then we all will discuss, including the MICA faculty also, and we will do something for our Indian community also. This is really very amazing experience for us also, and very grateful to you, all of you. Micah is very much devoting about this pandemic situation in his Baltimore locality and the community also. And I was in Micah at 2013-14, that same, not this type of pandemic situation, but lots of other efforts like that. The community culture and the engagement with the academic institution is very great there. Hope, that's great. It's still continue there, and hopefully everything is going good here there right now because after of the pandemic. And thanks a lot to entertain all the questions. Hopefully, participants will benefited from them. And please take care, both of you. And we will meet on Monday 5:30, the same time, with some of the other both faculties from MICA also. Thank you. Thank you.
Thank
Take
you.
care.
Thank you.
And have a
Have a
good
good
day to you.
one.
Thank you.
Bye.
Thank you, participants. If you have any questions, please ask to them also or us also anytime. Thank you.
Bye. Thank you so much. Take care.